Patients come and see me for a variety of reasons. Hi, I'm Dr. David Rowe. One of the most common symptoms, health challenges that people have, is low back pain and leg pain, which is commonly called sciatica. Now, we know that the brain sends strength and energy down the spinal cord throughout every nerve to every cell in our body, and then those nerves communicate back from our body up the spinal cord to our brain. And this communication loop is how we stay healthy and alive and thrive through our life. But if there's pressure from postural misalignments, what we call subluxation, it affects the nerves. The nerves that run from the low back discs down the legs are also dependent on an open free channel in order for them to function normally. But because of the amount of sitting and bending and lifting and athletic injuries and general stress through our lifetime, it is far too common that discs in the bottom of our spine misalign in their normal position, put pressure on the nerves, causing low back pain and sciatica. Now, sciatica can be a mild form of it where somebody feels just a kind of a heaviness, a leathery feeling in the leg, or it could be debilitating from streaming electric shock waves of pain that can absolutely alter someone's life. Now remember, only 7% of the nerves are pain sensitive, so the other 93% of the nerves that go to reproductive organs and digestive tract are also affected by these low back disc injuries. The sciatica itself is caused from pressure on the disc, from spinal postural misalignments, we call them subluxations, that are putting stress on those nerves. I'm here with Greg. We're discussing his experience about correcting his spine in the work that we do at Rowe Chiropractic. Thanks so much for joining in with us today. We really appreciate it.
My pleasure.
So you've got quite a history with this low back and sciatic issue. Would you kind of start at the beginning? Just give us a sense about what you've been going through prior to meeting us. When did all this begin?
This began in the mid-'80s when I went to see a chiropractor in Westchester County. And I was probably 33 years old at that time, and he told me I had the back of a 72-year-old man. He was my, chiropractor for many, many years.
Great, and you got great relief from it.
Yeah, it was, find the subluxation, fix it, leave it alone. So, it was in and out, and I went to him hundreds of times.
Fantastic. And then as time went on, the situation started to get more complicated and stopped responding in the way that it had been.
It basically did, yeah. I started to develop the pain in the lower left side of the left leg, and it would just, it wouldn't go away. But he really didn't recommend anything at that point in time. Back then they just wanted to do adjustments on you and send you on your merry way. So.
Were you pain-free at times, or was it always that you were suffering with the pain?
Well, it was pretty much, I was suffering quite a bit from the pain until 1989 when I met Dr. Ron Picardi.
How long did you suffer with the sciatica for?
8 years, probably 9 years.
At some point, Dr. Picardi took you to the Gonstead Clinic, right? Or he recommended you went to the clinic?
Yeah, I went there, and for some reason, Dr. Picardi could not fix my problem at that time, so he sent me to Mount Horeb in Wisconsin, and I met with Alex Cox, one of the brothers, and spent 4 days there living in the hotel that they had at the complex, and he adjusted me every day, and it was just no problem, and I left, and I was fixed.
Now, in 2016 or around there, you start getting the leg pain, and now it's not responding.
Correct.
Yeah.
I saw this physical therapist, and he had his PhD, and really he never analyzed my spine to determine what he needed to do to fix it. And he's trying to get me to bench press, my own weight at that point in time. And, it's like, I definitely don't want to put any more stress on my back than I was doing. I stopped going to him. He was making my situation worse. So I went to see a neurosurgeon, and in fact, 2 of them, and both of them said, you need to have a spinal fusion. And, I was totally against that from the beginning. And before I did anything, I always consulted, with Dr. Ron Picardi to see what his feelings were. And then when I spoke to Ron, he said, what you really should do is you should go to Mount Sinai. At Mount Sinai, Dr. Margetti's, and he did a laminectomy on me, and he got rid of the pain I was having in my left buttocks. This was 2022.
Okay, so think about this. We've got this complex pattern of there's a scoliosis, there's degeneration, that this is now, years and years, decades past when that first chiropractor said, oh, you've got as a young man, a spine of a 70-year-old. Well, now we've got years of further degeneration. You do the surgery and you get symptom relief.
Because I was at a wedding in the city at that point in time, New York City, St. Patrick's Cathedral, and I just could not walk. So I had to figure out what I was going to do. So I went back to have that third laminectomy.
Third surgery now.
Third surgery. And then I'm going up in the elevator with a 74-year-old man, and he's saying, this is my 14th back surgery. He's had spinal fusions, and I'm saying, this is not good. I don't want to be, having 14 operations. So home. But the third surgery didn't do anything for me.
Okay.
So then, I'm caught between a rock and a hard place. So I get Ron on the phone, and Dr. Ron Picardi, and I said, Ron, what do I do? And he's saying, I don't know what to tell you to do. I really don't. But he goes, only thing I can think of is, if I have a problem with my back, I go to see a Dr. David Rowe in New York City. He's the only guy I will let touch my back. And, by the way, now that I think of it, he specializes with people who have scoliosis. So, I have spinal stenosis, scoliosis, they're kind of hand in hand, I think. And, he called you up on my behalf and set up an appointment for me, and I came in to see you, and you took the x-rays, and you're the only doctor I ever went to that took x-rays in my back from the cervical area, thoracic and lumbar, and sat down with me for a half hour and showed me my spine. It showed me what my spine looks like. You show me what it should look like.
Yeah, that's a big point.
And then you show me what you would like to do as far as correcting it by 10 to 15% to get the pressure off the nerve so I can get rid of the pain in the lower side of the left leg.
That's right.
So
now we're back to what's the original problem? What's the original stress to it? So we come up with an adjustment for you, a therapeutic exercise routine, an in-office traction, a home traction. And because the pattern is so severe, we fit you with a Scoli brace from the Scoli Care Company. And so we're doing all this. We work together. Initially, we go through an initial intensive boot camp. We see you daily for a week. And you're not around the corner from me. You're driving in every morning. I'm getting there at 8 o'clock. You've been there for 15 minutes.
Yeah, 12 weeks.
Yeah, for 12 weeks. And then we saw you daily for a week and then 3 times a week. When you first put the brace on, what did you think? Honestly.
I said, this brace sucked. I wore what you told me to do. I was 8 hours a day wearing the thing, and it just...
Let's make a little more sense about what he was actually dealing with by looking at his x-rays. When we look at this x-ray, this is a back to front x-ray. This is his right side. This is his left side. His spine's supposed to be straight. Well, we see the scoliosis in his low back. This scoliosis is causing a disruption. These vertebrae are actually slipping off of their shelf. It's really degenerating. There's a lot of stress. This is the side view of his spine, and we put these 3 green lines in. That's the way his spinal arches from the side view are supposed to be. We look at his low back, that he's lost the lumbar curve. As a matter of fact, he's reversing here. We see also that he's got this stair stepping, that these vertebrae are literally slipping out of place. He's got his mid-back curve is pretty good, but his neck curve, he's lost that. But the biggest problem is this reversal of his low back. It's causing stress on the nerves that go from his low back down into his legs. The interference of those nerves are keeping us from sending a normal signal. His body's giving him pain signals saying, red alert, red alert. All right, let's look at the low back a little bit more closely. Now, this was the original x-ray taken in 11, 24, 25. Green is normal, he is red. Wow. He's lost the curve. As a matter of fact, he's reversing in here. And we see these vertebrae are stair stepping. Well, the nerves from the low back here send strength and energy down the leg. But that stair stepping, that misalignment, those subluxations are affecting those nerves. They're compressing them, so it can't send a normal signal. For 2.5 months, he did his home traction unit. He was also wearing a brace. Let's see what happened. The green line is the normal curve. He was reversed here. Wow, he comes into a much better curve. And the stair stepping, that misalignment like this is now coming into a much better alignment. Now these 2 bottom vertebrae, that's the main nerve supplying to the leg. Listen, he's still got massive misalignments, but it's way better. So let's look at the numbers, the measurements in his low back, and see if that helps us understand. So this is the side view of the low back. Now, Greg happens to have an extra vertebra. It's not super uncommon. Most of us have 5 lumbars. He actually has 6 lumbars. So between L5 and L6, that's 1 disc, and the nerve comes out of there. L6 in the sacrum, that's the pelvis, that's another disc. Now, normally between L5 and L6, this next to last vertebra should be minus 19 degrees. He was at minus 3, so there's quite a difference in there. When we did the corrective work, his X-ray 2, he improved to minus 10. Nice change, 166% improvement. That took a lot of the stress off the nerve. Let's look at the very bottom disc between L6 and S1. S1, once again, that's the sacrum, that's part of his pelvis. It's supposed to be minus 33 degrees in this situation. He was at minus 48. It's too much curve. He's actually pinching there. When we did the corrective care, he reduced it to minus 40.9, a nice change, a 16% improvement, fantastic. Let's look at the sacral base. The sacral base is a posture check. It's like, where's his pelvis supposed to be? It's supposed to be at 40 degrees, but he was at 25. And that mechanical postural misalignment was affecting those nerves, adding to this problem. But on X-ray 2, he went to 37.5, really good. Let's look at the translation. What's his cage doing relative to his pelvis? It's supposed to be at 0. If you look at the low back from the side view, the top of the curve should be right over the bottom. It's supposed to be 0. He was at minus 17. He's pushed back like this. When we're doing all this corrective care, actually went to plus 6. We'll get some more abdominal strengthening to stabilize that. But that pressing forward helped him build that curve. Not perfect, but a substantial improvement from the work that he did. And Greg really worked diligently at this. Let me describe Gregory's misalignment. His scoliosis goes like that. So he's actually shifted to the left and side bent to the right. That's his postural pattern in his low back. So we're going to create a therapeutic exercise exactly opposite, where he's going to elongate, he's going to shift to the right, and then side bend to the left. And by doing this repetitively, day after day after day, he's retraining both his spine, but also his brain on the correct movement pattern. So Greg, let's do maneuver 2 together. So we're going to elongate first, drop the shoulders. You're going to shift to the right, get to the weight bearing of your cage to the right, and then side bend against the pattern. And keep shifting right. That looks great. Elongate, keep shifting, 8, 9, 10. Now, when we talk later, he'll tell you that he put in a lot of effort into being able to find these movement patterns. But because he's been doing it repetitively, he's gotten really good at it. Let's do it one more time. Elongate, good. Shift right, fantastic. And in a right shift, side bend. That's perfect technique. You're going against the pattern. You're stretching the damaged tissues, stimulating the body to repair those tissues, but also training the brain on how to hold the body better. Fantastic, good. We're going to work on maneuver number 4 with Greg. And this is the maneuver that this is the mirror image exercise that addresses the fact that he's lost his normal lumbar arch. Now, we're supposed to have a curve this way. That's the built-in shock absorber of the spine. But Greg's lost that arch, and the pelvis angle, the sacral base angle is too low. He's basically postured like that. So we're going to elongate. He's going to create a little bit of shift to the right, a little side bend to correct the front view, and then he's going to press the cage forward, letting the pelvis rock forward. So let's try that. Let's try that maneuver. Good. So elongate, drop the shoulders, a little bit of side bend, a little bit of shift. Now all the effort is in correcting that lumbar curve, and lift that and press forward at that, and let the pelvis, and just pull the abdomen in a little bit, and chest forward, and hold it a full 10 seconds. 8, 9, 10. That's maneuver number 4. Great job. Fantastic. This is the adjustment for the correction of the reversal of the lumbar curve. We preset. He stretches down. He presses the cage forward. I just go and a little nudge like that. Fantastic. And then we use this drop mechanism. I'm just going to shift him like this. We use this drop mechanism to push him into correction. So we side bend and shift, and that's the adjustment for that, what we call maneuver number 2, his correction of the scoliosis. Great. So this is Gregory's traction setup. Now, we discussed before that he's got a reversal of the lumbar curve. So we're trying to increase that curve. So we pull this at a downward slope, and the tension is pulling up this way, and it's creating, imagine this, that the strap comes like this, and it creates lumbar curve. Research tells us that ligaments will not change shape unless you hold them in a corrected position for a minimum of 10 minutes. So we do the in-office traction for 15 minutes, supported by home traction unit with the den rolls with the specific foam blocks for 20 minutes. And little by little, we remodel the ligaments, the disc is a type of a ligament, into a better position so that the mechanics are better, the subluxation reduces, it takes stress off the nerve, and the nerves can begin to heal.
I had 100% confidence in you, and I'm just a disciplined person, and whatever I have to do, I do. So I didn't miss one visit with you. I was getting results. That was the main thing.
From the beginning, when I showed up, when my symptoms were at your worst, what percentage better are you now?
I'm at least 85% better with a pain in the lower side of the left leg. And, you know, it's discipline though. It just doesn't stay, you know, good. You need to do your isometric maneuvers. You need to do your traction, you know, at home, or else you're going to revert back to the same problems you had before. So I do what I have to do. It takes an hour a day, 20-minute traction in the morning, 20 minutes at night, and 10 minutes to do the progressive isometric maneuvers.
Fantastic. Good.
3 times a day.
3 times a day means 3 times a day. 3 times a week means 3 times a week. Thank you so much for helping.
You're very welcome. Thank you.
And I think this is going to help so many people that just, you know, they're stuck, like you said, a rock and a hard place. I say, where do I turn? What can I do? Well, there is hope. There is a way to correct it, but you have to go through the process of actually correcting your spine. Thanks so much.
You're very welcome. Thank you, Doc.
Yeah.